Hello, my name is Dr. Dziwe Ntaba. I'm a professor of emergency medicine and I'm also a public health practitioner. I've also been involved in helping design and implement educational programs for children with serious educational challenges. While Minneapolis is my home, I'm calling in today by video from Liberia in West Africa, where I've recently been involved in working to help prevent further outbreaks of Ebola. I'm calling in today because my cousin is in the Citywide Autism Program. The supports provided by that program helped my cousin move from federal setting 3 to federal setting 2. And I'd like you to know that all indications are that without those supports from that program, my cousin would still be in federal setting 3 today. So I'm calling because I'm concerned about movement of kids from program schools to community schools will they receive less support. When special ed programs are understaffed and the teachers are undertrained, there's risk of injury to all kids. Chairs can be thrown across the room, these children can get in fights with each other, with biting, kicking. All these things can lead to serious physical injury. In an understaffed classroom with troubled kids, sometimes the kids can slip away from the class. Sometimes they can even slip away from the school unnoticed. In New York, we had just such a case where a child with autism slipped away from the school. The school board was plastering the city with posters. Everyone was looking for this child. And unfortunately they found his body in a bog many, many months later. When children with autism are in a special ed room with children with other disabilities, their unique needs are often not served. And by commingling these children, especially groups of emotionally and behaviorally disturbed children, along with groups with autism, the school risks increased violence in both groups, as they oftentimes model after each other and hyperstimulate each other. Understaffing and lack of training also leads to bullying, and in some high-profile cases, this leads to suicide down the road. When we see these cases in the emergency room, we do everything humanly possible, but oftentimes damage control is the best that we can do at that point, and even sometimes that's not good enough. Even when the child survives a physical injury, the psychological trauma and the social trauma remain. So prevention is the only sensible answer. When we trace back the chain of cause and effect for traumas like these we see in the emergency room, oftentimes we find that these cases can be prevented. And oftentimes we find that these cases result from a series of poor decision-making made by adults. The time to change those choices is before the trauma occurs and not afterwards. So I ask that the district please take a very careful look at any plans to change the autism program and decide whether they can guarantee the safety of all children involved. Thank you very much again for the opportunity to participate in this important conversation from a distance.